1 in 8 women will develop breast cancer in their lives. Huge number. A significant portion of these women that develop breast cancer, 15% in fact, are actually high risk for developing breast cancer. If we identify aggressive breast cancer earlier, these women have a better chance of beating cancer and an easier road to getting there.
Usually by the time women find a breast cancer, it's because they felt it, they have a lump in their breast. The goals would be to find those cancers much smaller in size, and therefore they're much more treatable.
Because of the support and gift from Celebrating Women, we have launched the High-Risk Breast Program earlier this year, and in just the last few months, we've already identified 400 women who are high risk for breast cancer who would not have known otherwise.
There are 4 main goals of the High-Risk Breast Program. Number 1 would be identifying and informing patients of their risk status. Number 2 would be offering them additional imaging in the form of screening. Number 3 would be offering and supporting them seeing genetic counseling regarding their risk. And number 4 would be preventative measures they can do going forward.
The High-Risk Breast Program has the ability to identify these high-risk women, validate their risk score, prove the fact they are actually high risk, and then empower these women. Once they find out they're high risk, they can have a conversation with their physician and with us to have some options on how to manage that risk.
When women come to the breast center to have a screening mammogram done, the information they enter regarding their personal history, we can use that to calculate their lifetime risk of breast cancer.
And if we get tipped off based on all that data that the woman enters, that they are in fact high risk, then we will follow up with them. And that is where our nurse navigator reaches out to every woman that is screened as being high risk.
I'm one of the first ones who contacts the patient after they've had their mammogram, which identifies them as potentially being high risk. The purpose of it is to enhance their knowledge of what their risk is. It involves going through a 45-minute to an hour interview with the patient. At the end of that conversation, I'm able to tell them what their risk is, as well as to give them the recommendations for follow-up.
With support from Celebrating Women, we have taken this idea and made it into a reality. To grow this program beyond the Cass Center will require support of having additional nurse navigators throughout Baylor Scott & White so that they can deliver the same level of personalized care to every single woman who is identified as being high risk. We believe that this program will be the blueprint for how breast cancer is diagnosed earlier worldwide.